Okay, I guess this started as kind of I don't know, I felt like for 3 weeks in a row, we had like lots of clients just coming up with like forearm issues, and they were coming in, my forearm's hurting here, here, and here, and like on the fly, we were trying to change their program and go. So the goal of this is to basically get a brief look at some elbow pain. Shocker, it's gonna be talking about tennis elbow and golfer's elbow, but 2 or 3 basic tests that we can kind of run to try to narrow it down on exactly what it is that we're dealing with. And then I went a little bit deeper talking to some of my resources. I do want to say I am not a physical therapist. I am not an athletic trainer. This is all heavily researched using NATA, National Athletic Training Association, NASM, NSCA, a couple of different physical therapists that I talk to and work with in my network. They've all kind of checked off on this, that if you are a strength coach and you deliver these tests to a client, anybody higher up in the medical field should not like say, hey, you can't do that, you're not qualified. Basically, diagnosing elbow pain is all clinic like diagnosis. There are no actual imaging needed unless it's a chronic issue that's been going on for years and years. A lot of times, 2 to 3 weeks of laying low and off it could heal a lot of the issues. The thing with that being in this gym, if they come in and I'm thinking a Joe D came to me and said, hey, my forearm's hurt, half of his program was gripping and doing stuff. What do we do as trainers to not make that injury worse and still get him a good workout that he felt like he made the right choice? So I feel like helping them diagnose a little bit shows that we do know what we're talking about coming from a research background. We're not just guessing in the air and saying, oh, your forearm hurts. Let's not do that. We're just gonna do here. And jumping ahead a bit, talking with you, when Kenny came in 2 days, 2 weeks later, after Joe was over here, Kenny's like, oh, my forearm's hurt. We put him and we gave him the bar and started doing twists. Wrong. We should not have done that. We should have probably isolated a lot more. So with those things all in my mind, that's kind of where I went into this presentation, and we'll kick off with that. So knowing the elbow joint is probably the first big thing. It's important for flexion and extension of that arm. That forearm is in charge of gripping, rotation, flexion of the wrist, extension of the wrist, flexion of the wrist, extension of the wrist. Basically, when they come in with pain in the elbow, 70% of that time, it's gonna be inflammation, okay? Again, we throw around the term micro tears, overuse injury. Overuse injury is correct, but it doesn't necessarily mean it is micro tears. It could be inflammation. All of this is due to overuse injuries of little minute muscles in those forearms. Whether it's writing with a pen, typing, mouse work is becoming a bigger issue, and that's gonna diagnose or be shown, as you see later, as tennis elbow. Other things like Joe D, twisting, handyman work, hammers, screwdrivers, playing sports. Any sport can do it. Doesn't have to be golf or tennis to get those issues. If they fell, if they were slipped in their kitchen and they put their hand out to put down and they have injury, there's a good chance it's gonna be tennis elbow, golf elbow. Just inflammation through there is an umbrella term of that epicondylitis. So inflammation of the epicondyles, which are the 2 bony points at the end of the humerus of that upper arm, okay? A lot of medical people are now, epicondylitis is not what we want to refer to it as. It's getting referred to as tendinitis and epicondylalgia. I said that wrong, but it's pain of the epicondyles, okay? Those are gonna be those new terms as far as tennis elbow and golfer's elbow are kind of being tossed out because people are like, well, I don't play golf, I don't play tennis. Try telling Shirley that her forearm hurting is because she was playing tennis. She's like, I'm not a tennis player, I'm a golfer, right? It presents front of the arm or side of the arm, inside of the arm. Looking at tennis elbow first, that did not change. Boop. There we go. Looking at tennis elbow first, again, this is an overuse injury of the extensor tendons all the way up here on the lateral part of that epicondyle. So the outside part. This is caused by the repetitive extension and gripping activities. Again, this is 7 to 10 times more common than golfer's elbow. Okay, golfer's elbow is gonna be the inside, we'll get to that. Outside arm tends to be the biggest one. Also, the population that tends to be affected are people 30 and up, okay? That's getting more into, well, it's not like so much inflammation, it's pain. It's an overuse injury that hasn't just happened, it gradually comes on, years and years of overuse, and it might be there 1 month, not there for 2 months, and then all of a sudden it flares up. What were we doing, what injury, or what activities were we doing over and over that caused that injury? me thinking that's a Joe issue or even a Kinney, depending on how work was that week, what are we doing? Some of the symptoms are localized pain and tenderness on the outside of that forearm. The pain can radiate all the way down that forearm. If we did do grip tests, and coming from like a performance background, grip tests are something huge. One big study I noticed that as little of a 10 to 15% deficit from the right arm or the left arm, or pre-test to post-test, that 10 to 15% could be that red flag to say you have some sort of tennis elbow going on there. So even if it's very dull and Joe's been telling me, oh, it's feeling better, it's not gone, it's still there. So we still should be thinking in the back of our head, how do we rehab this? How do we rehab this without making it worse, okay? Movements that aggravate this are gonna be wrist extension, gripping, and then lifting with specifically that palm down to working those extensors a little bit more through there. Special tests to look at this one. Again, there are tons of different tests. Every physical therapist tends to put stuff out there and they gravitate one way or the other. These were 3 basic tests that I've been talking to my sources and then digging deep into the research have been actually proven with a little bit of research. One of them, which I did not include on here, had like 1 paper on it, but somehow it's gaining a lot of traction. It's a simple grip test. I'll run through that. I'm gonna try to click these on, or should I save off on the videos? I was gonna say, if you guys do have your phone, I sent a handout for both of these on the What's Up app right now. I'm sorry, I guess I should have sent that. I just sent it over before this.
That's okay. Do you know the tests?
I was gonna say, so the Cozen, I was gonna say, I don't know them. Cozen's test is gonna be at 90 degrees. Let me just click on this. Ooh. Oh yeah.
Nice.
Yeah.
Do you want audio or no?
I'm gonna skip ahead. The videos are all from a college I found. So they are good quality videos. This examinationvideos.com is really fun for you as you go through school. Dude, cool website, okay? But this, basically their audio is kind of talking about what tennis elbow is and just how it's gonna diagnose. But basically holding your arm, that 90 degrees, the practitioner is gonna palpate right on that sides of the epicondyle, and then flexing that arm, deviating into radiation, you are gonna resist and tell them to push into extension while you resist, right? So you're resisting, that's gonna flare up inside of here. Did it freeze? Oh. So very simple, it's gonna simply be, hey, how's your arm? So this is Cozen's test. Bend in, up, you put your hand here and say, try to straighten your wrist. All the way back out. Roger, you wanna come demo? So go 90 degrees for me. Extend up, deviate in, boom. Now try to extend your wrist, sorry.
Like this way?
Yep. You feeling pain through here? Mm. You don't have tennis elbow. But as simple through here, it's 90 degrees up, and then rotate that thumb in, okay? And then you're putting pressure on that outside, and they are trying to straighten their wrist back out. And with you palpating right on that epicondyle, as they go and extend, it's gonna flare up that muscle if there is an injury, okay? Back to PowerPoint. Mills test is gonna be passive flexion. So basically, we're going through here, you're flexing all the way up, and you are going to extend their arm out. So 90 degrees, boom, holding here, and then you are going to passively, sorry Cole, extend his arm out as he's coming back. Nice and easy. And holding all this up in here, yep.
So I'm gonna keep it an extension.
Yep, I'm holding you into extension, I'm not jamming you back, just gently holding into that and pushing. With this extension through here though, as you go out, those forearm muscles are kind of extending through there. So this is again where that gripping and actions of pronating are gonna flare up all through here. The third one, the Marty's test, not as bad. You're gonna lay it on a surface, pretend there's a table here, holding his middle and index fingers. I'm gonna say try to raise those fingers to the ceiling.
Oh, wow. Mm-hmm.
And very little pressure through here.
I feel that, yep.
Do you feel pain through there? Now, how bad you pass? Well, no, I was gonna say you pass the other 2 tests. If that's the one you fail, that doesn't necessarily mean you have an injury. It could just be stiffness, tightness, stuff like that.
Are you trying to do all 3 at the same time kind of thing? Or are you just...
The way that I kind of got it, if you test positive on the Cozen's or the Mills test, pretty good indication that you know exactly where the general area is, and then you can go forward in these next couple slides with doing it. But covering the diagnosis again, talk to the person, what activities are they into? Talk to Joe and Kenny. They are both very physically active guys like with their work. So using a hammer, a screwdriver, carrying things in weird positions is not out of the realm of possibility for them. It's probably just an overuse type injury. You don't necessarily need imaging. Now, if Kenny's injury gets even worse or Joe's gets even worse and anything we start doing on a conservative side of rest, ice, whatever doesn't get better, then it's like, let's go seek actual like imaging. But a lot of times they are just gonna say ice, rest, stay off it, modify workload, stuff from there.
He told me last night that he got diagnosed with bone spurs
Okay.
and that he's
Yep.
getting an MRI, but he said basically the doctor thinks he's just really weak in here.
Yeah. So
He's like, with the bone spurs, there's literally nothing I can do for you because
Yeah.
they won't do injections.
did they do imaging to find the bone spurs? Okay.
Oh, yeah.
I was gonna say, because the other thing, like, I think Shirley says she has a floating free body in her knee. Like, that's similar to like what a bone spur could be. So what caused those bone spurs in Kenny? Like, is it in fact an overuse injury where something pulled off in a way and it's floating? Who knows how bad did it get before he really noticed it? Kenny's a tough guy. Some of the other, okay, so sorry, let me.
Sorry.
Yeah, no, I was gonna say, so the big thing here, looking at that third one, bracing. Counterforce straps are those straps you see people put on their forearm and you crank real tight and it gives you temporary relief. Research that I found is legit 50-50. Some people it works, some people it doesn't. It's a Band-Aid fix and we necessarily should not lift and work out with that on because you're just masking that pain. As soon as you take it off, it's gonna come back with anger and vengeance and yeah, terrible. Like, if you need it to relieve pain around your daily life, 100%, but if you're strapping up there to come get a workout in, get out. Like, but we're, again, being at the younger age though, we're gonna bounce back a lot more, but as we get into the 30s and 50s and older, it's the degeneration of those tendons and they just don't heal back as fast. And a lot of times when they went in and looked at some of those injuries to see what the actual diagnosis was, like, everybody's like, oh, it's inflammation. As we get older, there were signs of no inflammation cells. So like, it's hurt and painful, but it's not necessarily inflamed. It's more the scar tissue or the granular tissue is what they call it, is basically building scaffolding, trying to fix it, causing a scar over top of those tendons that just doesn't move and glide as nice as a healthy muscle does. So that's where that pain is coming. But if you dig into it and work through it, you're gonna re-aggravate it and tear the scaffolding down, rip the scab off, and restart all over. So that's where their load management was kind of the biggest thing. Ice, rest, NSAIDs, like ibuprofen, stuff like that are always gonna be recommended. Bracing, only if you need it for sleep and stuff, because these are pains that can persist throughout the night, and just there. So if you wear a brace through the night, I think, hey, awesome, go for it. If somebody comes in with a brace and says, oh no, I'm gonna wear this because it makes me feel better, yes, it makes you feel better, but it's not allowing us to work in a healthy range of motion anymore. It's just a Band-Aid brace fix. So probably better to stay away from all of that. Okay, any questions?
Yeah, question.
Yeah,
Do you
hit me.
see anyone like, women that sleep like this?
Yep.
Do you see women smooth like that?
Yep, terrible.
Do you see anything with that on?
It's so that's getting into like the stiffness. It's just a lot like you sleep like that, you get super stiff in that part of the arm, and that's where a lot of the rehab part is light, gentle stretching of those muscles and defining it. I was gonna say I didn't see anything. I saw. Did you say you sleep with a brace?
I have to move
I-
I sleep like this.
Yeah, I was gonna say I've seen like a couple of the papers I saw were talking about like braces, but again that was just for like immobilization, like as you sleep type thing. Basically set it proper to then let it try to heal itself,
Yeah, I got
more or
an
less.
argument with the hand specialist at Florida Orthopedics. He's like,
Yeah.
when you're lifting, or you should stabilize this part because I have like sublux thumb joints, which is degeneration. So
Yep.
he's like, oh, you should stabilize it so it gets stiffer. And I was like, but don't I also get really weak from that? And he's
Yeah.
like, yeah, but at least you'll be stiffer. And I'm like, well,
I was gonna say time, like a time and a place. Like I would say, if you're doing things around the house and it's sore, like brace it if you're not having to use it.
Yeah.
If you're using it, take it off. But again, if somebody's pain is so intense that I need a brace all the time, and they come in like that, we should probably be staying off that forearm.
So how do we adjust programming based on this finding?
So going off of, oh yeah, getting into it. So On the handout that I sent you guys too, it's a PDF through WhatsApp. Those links, those tests are on there, so you can hot link those from there. I will also send you other stuff I have down here. So basically, I just looked for what are some of the recommendations of things. And down here at this AOS and comprehensive, these are 2 links that I'll send to you guys in an email if you want me to, that more or less lay out therapeutic programs to go through. The first one, the rehab phases, was interesting to me just in the sense that most people come to us probably in that first or second phase, the eccentric loading and functional. By the time we're there, they're already back into it. These people aren't coming in like Joe doesn't have a huge injury. It is simply let's monitor the workload for a little while, and in a couple of weeks, he'll be able to return to his normal everyday life, unless it is an actual tear. You know, if after 3 or 4 weeks, he's just not getting better and it's progressively getting worse, it might be, hey, maybe go see somebody legit about it. But as far as that pain management and gentle range of motion exercises through that phase 1, that's anywhere from 1 week to a month and a half, 6 weeks. They could be in that range. Again, you have 1 day off, man, I feel really good, but Joe goes back to work the next day and he hammers and builds something and all of a sudden it's flared up again, right? It's this give and take, 1 step forward, 2 steps back mentality that we're trying to break that cycle, but also everybody lives a life and you can't not do it. So doing little things over a period of time, hopefully it'll just kind of correct itself and heal back out. But the big thing I think is not getting nervous. Like my forearm has been jacked up. It's been jacked up for a while. It's getting better, but some days are better than others. Since doing research, I honestly think I'm getting better. I'm adding gentle stretching every other day. I'm doing more what the research says instead of what my mind thinks I should do, which is with Kenny coming in, we were like, oh, we're gonna just strengthen that. Kenny saw somebody and he said, oh, he cleared me to strengthen it. Well, he probably wasn't as cleared as Kenny said he was cleared because Kenny likes to work out. So that's on us probably to dial him back. Instead of that big rod, we should have sat him down right on his forearm and done super gentle stuff, or even just, hey, do an ISO hold through here. And if we hot link into some of these, I cannot find my mouse.
So for the eccentric, you're talking about
super
the ISO hold here and then
yep, and then go real slow down, even if you help yourself back up.
But the same exercise, what I'm saying.
100%.
Okay, gotcha.
Yep.
You probably want to start isometric.
None of
What?
what is
So
going
you
on?
probably want to start isometric stuff.
Yeah. So that's the first step.
All right, I messed up. Dang it. I broke it.
That's how you know you're over 30.
100%.
Well, can you help?
Well, I'm trying to.
What is it doing?
I was trying to get one of these links to work.
There we go.
There we go. Wow. See, why did it pop right up that time? It didn't do it last time. Okay, so this is just a program. Oh, you know what's messing me up? Left to right.
Those are really good to utilize for anybody that tells you that they have a
100%. This is a handout that if we wanted to, we could print out where it's hey, somebody's elbows sore, it lays it all out really nice, simple, easy exercises, all things that we've seen and we know, but again, just on a level of professionalism, if somebody does say, oh, I have this, tennis elbow, golf elbow. Okay, cool, I diagnosed it as tennis elbow. We have a laminated piece of paper in the back. Just pull it right out, boom, here's a protocol. Instead of these 3 exercises, we're gonna do this protocol. Still do your legs, still do this and that, but here's a tennis elbow protocol. Whether it's something we've seen here, I mean, there's quite a few different exercises, rubber band around the wrists or the fingers, simple things that we could then add into.
But that adds a ton of value for them.
100%, but also makes us, I feel more prepared. Where we're not just kind of guessing. We know what to do. If we all put our heads together, we could come up with something really well. Just give us 15, 20 minutes.
So what
This
you
is,
say use your exercises to diagnose, and then based on the diagnosis, if it's positive,
Go one
that's
way
when
or
you
the
give them that sheet.
yeah, go one way or the other. And this is just basically another one. This was a whole study that they did just looking at all the research into some of these tests and then talking about the different phases, what should we do in phase 3? We're looking at moderate to heavy loads. So if you wanted to dig deeper into what that programming is, this is this was a meta-analysis. So they use lots of research papers to come together to basically get these generalized rules. Doesn't work for everybody, but meta-analysis tend to be that better source of information for for stuff like this. So those are 2 hot links here I can definitely share at the end of here, but just interesting reads. There's tons of stuff out there. These were the ones that were probably the most cited in other papers, which is also a fun game I like to play. Find the meta-analysis and then find the one they talk about the most. Those papers actually have the nuggets of good gold in there. Okay? Yeah, you can get fake gold. There's fool's gold everywhere out there. So yeah, I just laid them out. I didn't want to go through all of them, but that rehab phases, that's covered right here in the journal, the bottom one. And then the top one, the AAOS, is the second one with the exercises, just kind of laying through there. But wrist flexor, wrist extensor stretches, super simple. Wrist curls, palm up, palm down. Just make sure that forearm's stable. Forearm pronation, supination. Exercises right here, right? Simple stuff. We did it with Kenny, but he was holding the big pull. Maybe a 3-pound weight would have been better, you know, a little bit there. Any questions?
So that's all just tennis elbow.
Those 3 slides were tennis elbow.
Yeah, got it.
Same framework for golfer's elbow. I'll let you kind of read through this, but basically, again, this is working those flexors, so coming this way, and then the pronator teres, that little red circle wherever my mouse is, over in the corner. Underside medial part of that epicondyle, inside part of the elbow, okay? If they have pain, what?
This is like tender spot. Like if you touch it hard, you feel it. No? Or at least for me it is.
Depends. Not normal. You might just be really inflamed. You might be, yeah.
I was about to say.
You should. I was gonna say you can.
Golfer's elbow.
Yeah. If you like palpate through there and there is pain, there's something probably going on. Is it gonna diagnose truly as golfer's elbow? Maybe not. There's a bunch going on through there, but golfer's elbow is pure golfer's elbow is a lot less common. So preferencing that, like, again, 7 to 10 times more likely to have tennis elbow. If somebody comes in, we run these tests and we think it's golfer's elbow, we're not necessarily wrong, but we might not actually be right because there could be other issues. The radial nerve runs all the way down the arm, ties in right around the medial part, and then goes up the arm and then loops in through here. You could be feeling something right in here, and I think that's what I have. I have some issue with my radial nerve, actually, that goes up in here. There's cool tests where we can do nerve glides and slides. I was basically told, stay out of this, stay your lane. Once you start dealing with nerves and stuff, we're strength coaches. If you put an older person and you radial deviate out to here, and you tell them to lean their neck trying to get a glide, a nerve glide, and they're old enough and they don't have it and they pinch, you just made them way worse. Yeah, so that's where unless you go deeper dive into the research and getting into the radial nerve stuff, like that's probably a talk for another day. Not saying we can't do it, but we are also not doctors of physical therapy or athletic trainers by nature. So probably stay your lane. Like these tests again that I kind of set up over here are very basic. Again, I talk to athletic trainers and other people. If I do this test, am I doing it wrong? No, it's a basic test. It's pretty self-diagnosing. People, dummy proof, yeah. Like, I don't know if I expected to find like some awesome test in my mind that I just didn't know about or see. These are all things that I've seen. I didn't know they were called a Cosen's test or this is a reverse Cosen's test. So if the Cosen's test was here and I'm flexed and I'm extending my elbow out, the reverse Cosen test is I'm bending, you're gonna hold down in here, and then I'm gonna extend out. You're just gonna hold their elbow right here and say, hey, when you go out, where do you feel this? Is inside, outside, going through, right? The Mills test, again, reverse Cosen, reverse Mills. We saw those. Where is my mouse? All right, Cole, I am totally messing this up.
Is that the view from your parents'
You're on.
house?
That's my lake house,
You probably.
Where's that?
Arkansas.
Oh, I wanna go.
It's my boat dock. Well, that boat dock is actually a resort.
I don't think I've ever been to Arkansas.
Okay.
When I think of Arkansas, I think of snow.
No, snow? They don't get snow.
I'm
It's
just-
ice, sleet.
When I think of Arkansas, I think of where on the map is that?
Where on the map is that? 100%.
SEC
Skip.
baseball.
I have carpal tunnel in both my arms.
Yep.
And I also have golfer's and tennis elbow, but that's like when I got diagnosed
Yeah.
with the carpal tunnel, it's like a combination of everything.
Of everything,
You can't
100%.
separate.
Yep. And like there's stuff with radial nerve that show as both. Like I show as golfer's elbow and a little bit of tennis, but when I start doing certain tests, I pass. So that's when it's like, if you're passing one, not passing the other, there's probably more underlying issues in those range of motions where it's wormhole deep dive. We just missed that. But again, simple tests, holding the wrist down, and then all you're doing is holding at the elbow, holding down into passive, and you're extending their arm all the way out. That's the reverse mills. The other one that we did earlier for tennis, you're holding back here, and you're extending out. Super simple. You learn one, we're going to learn both. If we're doing it, we might as well do both. Hey, Joe, come here. Hold his elbow, push him up here, extend him out. Any pain? Nope. Cool. Flip him over, extend him out. Any pain? Yeah, I felt it right here. Okay, well, hey, check box. Boom. That next one. All right. I was going to say that reverse Cousins, again, very similar. This is just working against resistance. Boom. So pronated, they radial deviated, and now you're telling them to straighten back out the other way. We were here going this way for the first one. Now we're pronated, deviating in, working back out that way. So flares up in those muscles again, holding and palpating on that medial and lateral epicondyle as they do those range of motions and working. That's where you're saying, hey, are you feeling it here? Are you feeling it here? Stuff like that. There is a simple test. I can't open it because I put it in my notes, but it's called the Polk's test. And again, this did not have a lot of traction. Research was like 50-50. Even a more easy dummy proof if we're not in the gym setting. Do you have any pain? Do you have any pain? And a lot of times, it's gripping the book this way and all the way out. It doesn't need to be heavy, up to like 2 pounds, 3 pounds. We'll do it, but also too light, like a phone is probably too light. This book may be a little bit too light, but.
Stuff like coffee cups and stuff like that used to destroy me.
Yeah, but something like that. If somebody comes in and says, I can't hold my coffee cup, like, I don't even know if you need to run tests at that point. But that was called the Polk's test. That was just like a simple grip test. Other ones that I saw were like a stress ball, like have a stress ball and do the same thing. Like have them grip the stress ball 4 or 5 pumps and then squeeze tight and then try to go out. Was there any pain in those? Simple research back behind it wasn't like super definitive. I think it really is just kind of the redheaded stepchild probably of the PT world where somebody's like, oh, this is a good idea. It passes this test and somebody's trying to get famous off of it. They put their last name and call it the Polk's test. But not a lot of research done on that. Again, this is going to be just a exam that you do in the clinic. Like you don't need imaging to see any of these unless it's like a huge issue that's been going on for a long time. Load management, deload a lot of stuff, ice, NSAIDs, and wrist support as needed. Again, with that golfer's elbow, those actual counterforce straps aren't going to help as much with golfer's elbow as it does with a tennis elbow. So if they're like, oh, should I get it to relieve pain? Like maybe it might be just placebo at that point for that person. So some people it might work, some people it might not. Really just rest ice, try to deload as much as we can. Going into what they kind of recommend. Boom. There it is. So working on wrist flexor, wrist extensors, stretches, wrist curls with just that palm up, and then supination, pronation drills for that golfer's elbow is going to be the way we tend to go. Anything, and again, if you're like, oh, what should I do? Think what movements are going to work that inside of the forearm. Anything like there can be that rehab. What's going to work for the tennis elbow? Anything where we're using those extensors in the front. Okay. I did again. Oh, you can't.
So the pronation supination drills are for both.
Yes.
Okay.
Yep. Dang it! I'm trying to get onto. So this is Mass General, Massachusetts. This was like a rehab protocol that they put together in their orthopedics lounge, or department, sorry. I know, but I can't see it on mine. Like when I do that, I have to reset. And then I just get the black screen to death. All right. So this is the Mass General one. Again, talking about golfer's elbow, just the different factors into it, good research through here. The return to sport, just talking about things they're trying to see. And then it gets into just some simple, again, diagrams of what those exercises are. Hey, Bob.
What is up, Bob?
Boom. So again, this could be something where I'm not saying we use this exact one, but if we like some of these, we could snip, take some here and there to create our own handout of things that we like. All research backed. So good stuff, cleared.
I love how at the top they put a
Yes,
Thanks, that's helpful.
very helpful, just in case you didn't know what was. But again, you don't have to play golf to get in.
That's what I'm saying, it's more that. It's like, okay, wait, now you're even more
Yeah.
in the category for people.
All right, so can I get back into? Boom. Okay, and then again, I won't go through them, but again, just showing some of the other exercises from websites. I found a lot more stuff on golfer's elbow as far as protocols, but they're shorter. Like you saw that last one is like 3 or 4, just doing flexion, rotation, things like that. A little bit goes a long way, it seems. Whereas like the extensors were, I don't know, maybe a little bit more detailed, or they're just adding more eyewash to the whole thing. Like, oh, let me try to feel it better. But again, ISO holds more for that top is what I got. And for here, you are actually going to try to strengthen a little bit if they're able to. But again, if they're in the acute phase of like it just happened, probably stay away from actively trying to strengthen that. It needs to be more, let it rest, recover, and try to just manage that workload and stress. Let it come back down after a couple of weeks of inflammation. Let's see if there's anything I didn't cover. Any questions for me?
What do you think about,
I was gonna say I can.
like, along with like the rest recovery thing? What do you think about like they're just like moving it instead of like even?
I think I like the adage like motion is lotion, right? That like that's solid as long as it's not strenuous motion.
Yeah.
Like then that motion falls into like the light stretching, which is what they kind of get into. This was a weird handout actually, just because they went out of order. But this was a really good handout too. So it actually starts here at this one, but it starts with stretches. Those first 2 or 3 are like just stretching, and then it gets into the strengthening. Like this one right here, I would say, dude, this could be a print out and like ready to go right away. Like it's clean, concise, there's not a lot of fluff going on, and they call it the 10-minute tennis elbow, even though it's for the golfer's elbow. It's used for both of these, right? Yep. So if you go into this Great Western Hospitals website, basically they've put together a bunch of, I don't think I have it open up there. I have a million tabs open, guys.
Like Roger.
Yeah. But these, I can send links to all of these down here too. Why can't we?
Don't you have them in the PowerPoint?
I can send you the PowerPoint too. I didn't include these links just because they're more research based on that handout. On that handout though, the PDF that I sent you, those links do go to the tests and stuff. So yeah, this is just another good one. But basic stretches through there. Really short though, right? Boom. All right, and then get back on here. And then if I were to go further, we'd talk about more like that work to play. But I think the overarching thing that I kind of learned was motion is lotion is good, but heavy resistance is not necessarily the way to go. When they first come in and they probably first or second time they complain about it, think more load management, isolate that movement, don't let them necessarily flex into things, light stretching as tolerated. And yeah, just try to emphasize like we need to let that rest. Other modifications we can make. Doesn't necessarily mean we can't do push-ups or pull-ups, neutral grip. Like when in doubt, like go into the neutral grip if we are gonna continue to work through stuff. Like if Joe is doing something but it bothers his wrist, but then he has presses, doesn't mean we have to take presses away. Maybe lighten the weight, but also say, hey, instead of going here, go that neutral grip, stay neutral grip, see how that feels. If it aggravates pain, I would probably say err on the side of caution for the first day or two and take that away too and even lighten up from there. Push-ups, using push-up handles could be a way around it. Swiss bar push-ups, just that neutral grip on things like that. Same thing with like lat pull downs, stuff like that. Things with holding weight, I would do if just at the wrist. I would have that forearm like here, like have it braced, like don't let it sink.
Lunges.
I would say neutral grip down there, but also you're not holding into flexion or into extension, so it should technically be okay. Unless that weight just actively pulling through that hand is like pulling at the joint and bothers them, then it's probably a shoulder issue. Like we should be stabilizing up there anyways. Like, but golfer's elbow especially is, gets messy here with that radial nerve coming up into here, and then you can start going down the wormhole of, is it really an elbow issue here, or is the underlying issue a shoulder scap control through there? So kind of gets, tennis elbow is easy in my book. Golfer's elbow is a little bit trickier because I think, as you mentioned, like you present as different things as both of them. you're probably presenting as a little bit of something with that pain. Like, should that hurt as you palpate? No. You have a little bit of pain, like, right? So is it take golfer's elbow, or is it actually like radial nerve? Is it something tight in the triceps? Who knows? More studies will need to be done, more tests. I was gonna say, you're really sore on your forearms. The one thing that as I'm coming through like all the stretching and stuff, like it makes sense. The one that we already have in our books that I've never seen at other gyms is the forearm loaders. That forearm loading series, that's something we already have that we could throw to people. Like that could be a very simple like go-to. We already have video on it, like go into there, or we just include it in one of our like handouts, a forearm loader. But like that's the way to kind of like go into it is like, okay, hey, we're gonna take those motions away that are causing pain. We're gonna keep you in neutral grip. We're gonna deload a lot. We're not gonna necessarily flex and actively try to make it better. Like, I think Kenny, when he's going, he's like, yeah, I'm pushing through pain. It's gonna get strong. We need to like, you wipe that from people's minds. Like, you're a big, strong guy, Kenny. We know that. Like, this is not damaged, but if we keep going, we're gonna make it worse and worse.
I know Kenny specifically, when I coached him before, when he does TRX rows, he finishes like this.
Yeah, he curls his wrist in. So he's getting a lot of that, yeah, a lot of those forearms.
So something to keep an eye
Yeah.
on.
He doesn't. And then, well, that's why is Kenny doing that, or why is Linda doing that? Is it a scap thing, or is it in fact elbow, forearm pain? Like, does he feel better? Yeah. So.
I mean, I think a lot of my issues come from my scaps because I have very, very clean scaps.
Yep.
My scaps go everywhere.
Yep.
Did you read anything about like full extension, full flexion?
Of the wrist or the elbow?
The elbow.
So at the elbow, that's that one test where we're going all the way out, causing pain. Like if it causes pain, like stay away from that full extension.
Yeah. That's the way I got out of pain a lot by doing neutral
Yeah.
pull-ups and chin-ups, is
Yep.
keeping myself in like a
Shorten the range of motion type thing. Like work through non-painful ranges of motion. If you get into a range of motion where you start feeling it, cut it short. Like I don't care if it's only a half rep, like that's where we are today. We'll be further next week.
So
But
is this something that you only do if you feel it, or if there's somebody comes in and tells you for the first time out of all the coaches, hey, I have pain in my elbows, do you just cut the range of motion to not be fully straight right away, or you just do it because they're not feeling it? When they're doing it, they're not feeling it, but they came in saying they're hurting. You see what I'm saying?
you came in, said you're hurting.
But then, that's the first time any of us have heard it.
Yep.
So let's say you're in charge of that.
Yep.
Do you let them go full range of motion in a row, or do you cut them short now knowing that they're hurting?
Roger, I want you to take this first set a little bit easy through this range of motion. At any point in those first couple of reps, if we're getting pain at the back end of the range of motion, I want you to shorten up from there. I would go that way.
Yeah, because if they're coming in first showing pain,
Yeah.
the idea would be to back up everything.
100%, yes.
Not go into anything.
Not go into it anything super crazy. But if it's like a underhand row, then the first thing, hey, put them neutral. And only if they're able to tolerate. They might not even be able to get all the way out there. But doing this test would tell that. And you say, oh, hey, well, remember we did that test and it was very simple and you were in pain or you felt pain? Well, I don't want to put weight in your hands and then have you pull or row or push if it's causing pain with just my hand.
Yeah.
Right?
It's a good buy-in for them. Like, oh,
Yeah.
okay, that makes
Yeah,
sense.
like if passive, me helping you hold your arm and extend out is causing pain, a 5-pound weight is going to cause infinitely more pain. So, well, not more pain, but more damage, let's call it that, because people handle pain differently too, so.
Did you find anything about which one is more painful, if there's such a thing? Not really.
It's all perception.
Yeah.
And also probably then the severity of the injury. How long has it been going on? I talked to Matt C today. He still has like a little bit of, he's probably one of these. Yeah. What do you got?
He doesn't say it.
I was gonna say, when you talk to him, he doesn't, but we had barbell curls today. And I was like, hey, how's the elbow been? He's like, oh, it's fine. I'm like, how's the elbow in pronation? Like, he's like, let's just stay on the lighter side of things. Like, he's been okay. He didn't feel pain as much today, but he says it's still there when he's doing things around the house. So it's a lingering issue for him. So it's like, I guess this is open for the table. On cases like that, what would we do as trainers? Like, do we monitor his program and taper a whole lot back? Or if he is getting better, slowly, but if he is getting better, do we just stay the course and try?
You know he's getting better if he's not telling us.
100%.
So we find out it's too late.
Well, besides that, I guess like we haven't really implemented any form of rehab on him, right?
Right, yeah.
So, I mean,
It's just been working. It's been like,
Necessarily.
I was gonna say some things were worked with, right? Yeah, we changed, you monitored
Like,
stuff.
That was like however many months ago. Now
Yeah,
I
like
haven't-
2, 3.
Right.
I haven't been.
I was gonna say, yeah, now today his new program, like we're doing pronated barbell curls.
He's heavy arms.
Yeah, yeah,
He's really
yep.
heavy arms.
So,
Everything I researched, like when I first started having one of those issues, were like people like when you look at Reddit, people have these issues for like decades. Like,
100%,
like
yep.
tennis elbows
Yep.
over for like 12, 15 years. And
Yep.
they like slowly try to rehab it, and eventually one day it just goes away.
Yeah.
So it's almost like even though he's not like as persistent as he was, does it make sense like once someone's red flagged as an elbow person to like always have some sort of
Right.
protocol in their
Yeah, yeah.
program? It's like maintaining that.
or it might not even be, the part of the protocol could be simple stretching. Like stretching those forearms in the workout could be a simple thing we start sprinkling in, you know, for Joe D, for Kinney, like just part of,
Box that your elbow's in pain or it's been in pain
Yeah.
past times.
Yeah.
We're gonna be added.
yeah, let's start adding add some stretches at some point, you know?
Because I know what it's like to be Matt C, where you're just tired of it. So
100%.
It's
Yeah.
just, it's not as bad as it was, so I'm fine.
Yeah, you're gonna just keep going, proceed as needed, and when it flares up type thing.
They also, hand and elbow doctors also worry about, like, because I'm really obviously mobile, so like when I stretch, he's
Yep.
worried about me actually tearing something.
Tearing, going too far.
And then once you tear
Yeah.
it, they have to like,
Yeah.
obviously.
Yep, that's where I think just
So, like-
easing into the stretching and everything. Don't try to jam into it because it's not gonna fix it,
The
but
problem with her is that she doesn't do light stretching because she doesn't feel anything that's light
Right.
unless
We need
it's
so both sides, other sides of the
No, I mean,
conversation.
Yeah.
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 And
Light
what-
stretches is the way.
Light stretches is like the way to go, and then hitting stretches probably from different angles. Like, hey, you can stretch here and here. Okay, well now go all the way out here and all the way out here.
Would you say Stockman curl is a little bit more progressed?
Yes. Yep. Yep. One of
What things bug Matt? What kind of like exercises bug him?
hammer. He told me hammer grip was hurting him the most, which surprised me. No, barbell curls today, he said, was fine. We stayed lighter. We stayed 35 pounds.
Pronated or supinated?
No, hammer curls.
No, but
Neutral.
barbell curls. You're saying
He did. Yeah, he did. Supinated, sorry. Yeah, he did right. Yeah, supinated curls, like, he's like, oh, those are fine. But we stayed lighter. We stayed 35. But he said on the note, because he had them a couple months ago, and on the note it was like, oh, dumbbells, switch to dumbbells this day. And I was like, well, that must have been when he like initially got hurt. So I was like, hey, I'm totally cool with doing, you know, neutral grip hammer curls if we want to. He's like, no, those actually bother me more now. So that's a thing where had we tested him a couple months ago, how was he presenting? And now test him, how is he presenting? Has that injury actually morphed into something else? He's compensating. Notes. Yeah, I was gonna say client notes. Yeah, for Matt's client note page, 416, elbow pain, ran test positive on tennis elbow for 2 of the 3 tests, you know. Retest in 2 weeks or 3 weeks, you know.
I love this because I think
So-
it also opens the door to like other body parts that have similar, like,
Yeah,
we see
100.
similar issues in the knees or
Yep.
things like that. Like you have your basic little
Yeah.
laminated sheet that you can.
Yep. I think I would feel very comfortable saying, hey, we could very easily from these links here, we could put together a handout for golfer's elbow, tennis elbow. And if we went to an physical therapist, Jan, and say, hey, can you check this over? He'd be like, yeah, that looks good. There's a lot of information out of there. The stuff that I pulled, again, I was going through like credible resources. Like Reddit is a good place I like start, but always going like NASM, NADA, because there are Instagram, there's people out there just throwing fake stuff out there. I'm gonna make up my own test. Oh, it's the cell phone test. Oh, that's the Hype's grip test, right? Like that's kind of what's happening. But they're
People like me struggling with the same.
yeah, but they're all just coming. They're all coming from basic movements that are that Mills test and that Cozen's test, regular, reverse, stuff like that. So we don't need to know a lot. Like I thought there was going to be 2 or 3 crazy in-depth tests, and really it's kind of basic, more basic stuff. But it's just narrowing down and then handling it the right way. Where as a strength coach mind, I was straight on with Kenny's like, yeah, I got cleared for this, and he said I could do these exercises. Like I remember that conversation. Kenny's like, I got cleared. He told me to lightly start strengthening it. Kenny, who the hell did you go see? Because that was probably wrong. It probably should have been, you need to rest for like a month, 4 weeks to a month, and not strengthen the forearm. At some point, yes, we need to work on that strength, but you got to let everything calm down a little bit before we go into it. How? 100%, yes. Maybe that. Yes.
Right,
Yeah.
That's what they start getting pizza.
Yeah, I was gonna say ISO holds always first. So, yeah.
Speaking of Jan, I actually had a meeting with Jan yesterday, and we're gonna try to organize a time for us to go to his facility, just to meet his therapist, and like for them to see our faces and know who we are.
Cool.
That we're not just
People.
nobody's